Hello and welcome to another edition of the Osteopathic Lyceum podcast. I'm going to attempt to do what I consider a service to educators in the osteopathic field. Now, not everybody's going to be familiar with this term. Not everybody's going to care about this term. I happen to see it popping up again, and it's only because I have what I would call maybe a specific or a narrow view or a narrow viewing window into some things. My aim is one that I would claim as positive, okay? The term that I'm hearing that I've experienced before, part of the reason that I've experienced the term before is physical proximity to the location that the term showed up, or the term was generated, or the integration of the concepts that underpin the term were generated. So that's Hamilton, Ontario. The term is problem-based learning, and the university it was generated from was McMaster University. I think the claim is it started in chemistry, but then it gained popularity because it was applied in the medical school at McMaster, and this is in the 60s. Now, before I go any further, I would like to make something clear. The Masters of Science that I have in Health Science Education is sort of the culmination as a program of a lot of the stuff that the researchers in health science at McMaster, so you're going to have multiple departments to talk about PNB or psychology, neuroscience, and behavior. You're going to have health science. You're going to have the medical school. These are the same people with cross appointments. The individual that is primarily responsible for the health science education MSc program, not the person who's running it, but the person who essentially started it as a culmination of research across time and interest, is Dr. Jeffrey Norman. Dr. Jeffrey Norman had a lot to do with progression of problem-based learning. I don't believe that he was there directly at the beginning, but he was there very early. Dr. Norman's PhD is in physics. He does have a master's in cognitive psychology from the University of Michigan. His nuclear physics PhD is from McMaster, unless I'm going crazy. I happen to have some level of connection to Dr. Norman outside of simply being in the program or having achieved my MSc from the program that he more or less directed and started. The reason that I've had some conversations with him is because I purposefully go to events that is put on by Merit or the McMaster Education Research Institute. I never remember the proper acronym for Merit, but that's run primarily by Dr. Sherbino, who's a wonderful guy. I have the opportunity to speak with Dr. Norman as a result of that. Also, I regularly, every year, attend what's called Nerd Day, or the Norman Education Research Day, and is definitely named Nerd Day on purpose. But as a result of that, I have the opportunity from time to time to speak to Dr. Norman. Also, my thesis supervisor, Dr. Sandra Montero, was, I believe, supervised by Dr. Norman. So I say this to try to situate myself contextually so that what I'm saying doesn't sound like I'm just being a complete jerk. Problem-based learning is not a specific area of expertise, but because I have a background in health science education, at least at a master's level, it's a term I'm familiar with. It's a term I'm familiar with because I heard it through osteopathic education. It's a term I'm familiar with also because in attempting to do my thesis and looking for educational interventions or concepts in osteopathy, I came across a paper, and I don't remember if it was the special issue in 2013 or 2014, but the International Journal of Osteopathic Medicine did special education issues in 2013 and 2014. One of those papers was talking about problem-based learning in osteopathy, and really what it was is just talking about problem-based learning and saying it would be awesome. I believe the author was Canadian. Not 100% sure about that. Okay, lots of situating myself contextually such that my aim to talk about PBL has a positive motivation. I want to try to disabuse people of thinking PBL is special in any way. PBL fundamentally holds the position that small group work with specified roles based on usually a chosen problem, or like say a list of problems that the students can choose between. So they form their groups, or the groups are formed for them. The problems are presented, they choose the problem, they go out, and they each have specified roles in generating the information that will then be eventually digested and presented in most cases, whether it be written or verbal, usually verbal. It's small group work. The underlying concept is that when the students have more autonomy, especially in choosing the problems, they will be a little bit more engaged and learning outcomes should be a little bit better. They'll also, by accident, learn communication, collaboration, and teamwork skills. Like collaboration and teamwork, sort of the same phenomenon, but they'll learn these skills which then are quote unquote applicable in the real world. So the basic phenomenon is identify problem, research, collaborate with others, aka call on others who you think might have the information that you're interested in, and build a network of knowledge through research on paper or asynchronous resource, if you like that term, and other humans. PBL formalizes that. That is entirely normal student behavior. If there's something that they're misunderstanding, they're going to go look at their resources, see if they can figure it out. If they feel like they can't figure it out, they're going to phone a friend. The other challenge sometimes is, especially with respect to autonomy and interest, the students don't necessarily know what problems they need to figure out. So which is why you formalize and you give them a list of problems, and then as they present to the class is supposed to more or less digest the information that they've been given by their fellow classmates and the other groups, and they don't know what problems to investigate necessarily. They can have interest, but it's an old Simpsons clip. So the show The Simpsons, based on interest, it's like Homer says that he's within a certain age bracket and everybody wants, like, I'm a male, age 18 to 34, everybody wants my opinion. And he cracks the cupboard and there's a tin that says nuts and gum together at last. Essentially to show that sometimes the consumer, or in this case the student, if we're going to substitute concepts, wants things that probably aren't that interesting, useful, or good. It doesn't mean that you're crapping on the student's desires. It means that they don't know what it takes to become the thing they're trying to become. They don't necessarily know where the knowledge that's going to help them exists. PBL would claim, or attempt to claim, or its advocates would attempt to claim, that they'll gain that skill of information consumption because of the problem. Okay? Now, when I talked about Dr. Norman, part of that is to set up that Dr. Norman, I think it was, one of the papers is 2008, one of the papers I think is 2012. One of them is 50 years at McMaster, or that's the title. And another one was I don't think it was a proper maybe it was a proper meta-analysis. I think it was a meta-analysis of PBL. I might be going nuts. I don't have them in front of me, so I'm going somewhat off memory. Relatively early on, PBL was not showing improved results against other forms of teaching, especially over the long run. So when you looked at things like physician ratings over time, and I think it's physician ratings by patients, PBL is no different statistically in whether or not the doctor was rated as poor or excellent. PBL is really no different. So if it's going to be really no different when you attempt to detect its impacts in physicians throughout a career, then what's the point? It's possible that if you look at shorter time scales and you compare PBL to other interventions, PBL may look good, but in the longer run, it's sort of a wash. Now, what that suggests is that there's other phenomena at play. What PBL does seem to do a good job of is improve ratings of student satisfaction. Ratings of student satisfaction matter for engagement, or more appropriately stated, they matter because they predict students will be less likely to disengage. So if a student is more likely to disengage, they won't be exposed to information to help them perform the thing that they think they want to perform. So if you piss them off too much and they turn away, that's not good. If you're overly positive and you turn them away, that's not good. But if you can find something that seems to generally keep them engaged, then all the other phenomena that are happening that we're maybe not considering are going to happen across a career. They'll probably perform similar to the normal distribution of their peers. So PBL does something for student satisfaction, but not for performance, especially not over a career. You will definitely find, if you look around, papers that are going to support PBL as an intervention. You'll probably find some that show some statistical significance. However, situated in the context of being proximal to people like Dr. Norman, I can say that it is unlikely that it's worth leveraging. Aside from if it is your way to keep students satisfied. If it's your way, I get it. There's a newer concept called student-led learning. So I'll backtrack a little bit. Apparently, one of the things that drove PBL partially was, hopefully I don't screw up his first name, it's Thomas Dewey. I've talked about him before. He was the guy that coined the term critical thinking and then basically stopped using it. So everybody's over-leveraged the term critical thinking, even though the guy that coined the term stopped using it. He turned into calling it reflective thinking. There was another one, but then he just called it thinking. So my contention is thinking, especially because it is bound by details. The critical thinking term was essentially Dewey's way of pointing to a scientific frame of mind. Right? Now, across time, partially because of Dr. Norman, we can see that especially expertise, especially in healthcare professions, medical doctors specifically, that decision-making and diagnostic decision-making is much more about trial and error across time. So the physician knowing that they've tried things, it's worked this way, it's worked that way, and then they sort of normalize over time to get a better, say, Bayesian understanding or an odds-based understanding of what might work, what might not work in a particular situation, as well as very, very specific expert-level knowledge. So, anyways, Dewey informs to some degree some things about PBL, as does Harvard. I think there was something at Harvard in the 30s. I don't remember exactly what it was, but there was something there, and that influences PBL. PBL pops up on the idea, or highly related to the idea, that the autonomy or the student choosing some level of their engagement based on the problem that they choose would be positive. Now you have student-led learning. So student-led learning is the newer term, so that the student chooses what they want to learn and then you help them learn. Well, to be able to do that, you need to have access to people who would be able to guide them appropriately if you're not the person to do it. So let's just say the student wants to learn about a topic that you really don't know much about. Maybe you need a content expert or a subject matter expert, and you don't know how to find one, or your network doesn't include one. So you run into some problems. And again, the fundamental flaw with student-led learning that is easy to encounter is that the student's desires do not match up in any way with what would be useful for their professional level performance. It's nuts and gum together at last, again. So the place that you'll see this phenomenon going relatively well is graduate or postgraduate level studies, so masters or PhDs, especially if there's a thesis, especially if there's an experiment-based thesis. So the thing about master's level study is that the student has to choose that they want to do it. So I want a master's is essentially what they would have to choose. Then they need to have some understanding of what they're interested in. Then they have to go find somebody who is doing something close enough to what they're interested in that they could become one of their students. So that person could appropriately guide them proximal to their expertise. usually what happens is you end up in a lab and you sort of do some portion of what that lab is interested in. So unfortunately, a lot of grad students and post-grad students just become really good bench workers. They don't necessarily become good scientists, but there is a self-sorting based on interest. And then they go ahead and they get some guidance from somebody who knows more than them, who's a subject matter expert in the form of a PhD running a lab, or just a PhD who's supervising a very small group of students who doesn't have a lab. That's a thing. So maybe PBL is just an attempt to formalize at a lower level of education a thesis-based process where you have an area of interest and you have to go build the skills to be able to pose a question, to be able to formulate an experiment, to test it out, blah, blah, blah. But realistically in PBL, you're not running experiments, you're just reading and then reporting, right? So PBL, as it stands, might be really good at making you an information consumer and reporter, but it may not necessarily be good at helping you generate unique insight. It helps you gather insight of others and digest and assimilate and share. So as a method, PBL is attempting to formalize and leverage some level of autonomy and interest, something like the optimal theory of motor learning, which does inform how the Osteopathic Lyceum delivers the actual physical hands-on curriculum. It's optimizing motivation and attention for learning is what that breaks out to. That acronym I'm okay with. You have AS, or autonomy support. If you give students full autonomy, they don't know what to choose. So the way to do this is look at, or the way to talk about this, maybe that'll be easy to understand because it's the way that I've digested it, is to look at consumer decision making. If you have if you have like an unlimited amount of shampoo, you'll always feel like you could have made a better choice, so you'll always have buyer's remorse. If you have 2 shampoos, the other one could be better. But if you have 3 shampoos, you have enough that there's an appropriate amount of choice between them that you think you've made an informed choice, you feel okay about the choice that you made. The place that you see most of the choice in motor learning studies, because they use putting, like golf putting as a task, is things like the color of the ball or the color of the mat that they're going to use for something. But what you find is when people have some level of bounded autonomy, they can choose how they want to do something within a narrow range that's been set up for them. And you could call that the initial presentation of problems with respect to problem-based learning. It's like there's a list of problems, which one do you want to do? But what you seem to find, at least on motor learning tasks, is that when people have bounded autonomy or autonomy support, and they can make some choice, but it's bound, it seems to have a positive outcome on motor learning tasks. Then you have enhanced expectancies, either success, so they succeed and they feel good about it and they expect to succeed again, or positive social comparison. So something simple to do would be, almost all of your peers, when they try this for the first time, they perform pretty well. It's not that hard. I think you'll do really good. Positive social comparison falls into enhanced expectancies, and then it's EF, external focus of attention. So don't tell people to focus on what they're doing, focus on the outcome goal. So in osteopathy, you wouldn't necessarily want to harp on what the patient or what the practitioner's hand is doing. You would want to point to, I want you to generate cervical rotation with the patient in lateral, right? So that kind of combines the optimal theory of motor learning with autonomy support. It's like, okay, I'm not going to tell you exactly what to do with your hand, but I want you to experiment with what to do with your hand. So that's the autonomy. They can choose. You bind it so it's lateral only and cervical rotation. I didn't tell you how to turn the head and the neck. You could turn the torso. Stuff like that. And then generally saying, yeah, almost everybody figures this out. That's enhanced expectancies. And then the external focus of attention is, I want the neck to rotate, not do this with your hand. So that kind of combines it all. Lots of what some of you may feel like is rambling. If you go back and you have the time or the motivation to look at the stuff that I've said across time, you'll see that there's, I think, consistency. PBL it's kind of window dressing on stuff that's going to happen anyways. There are other things that explain the phenomenon better, allow for an educator to make better choices, and make less assumptions about what's going on. If PBL is your way to leverage student satisfaction, again, I get it. I think there's other ways to do it. But if you're going to harp on PBL, if you're going to make PBL the center of your claims, if you're going to make PBL something that guides things like documents for guidelines. So say you want to put PBL in something like the CSA document or the CEN document, Standards in Education for Osteopathy, the two organizations, the European and the Canadian, or the WHO document. If you think that PBL should be in there, you're misunderstanding the basic phenomenon and that there's better ways to do it. PBL has a history. PBL, if you poke around, you will definitely find some stuff that says good stuff. But if you look across time, it's kind of a nothing burger. And there's other things that are a little bit more fundamental. If you start with something like PBL and you give it enough time, say the early 70s where Dr. Norman was there until now, you see an arc of evolution in understanding of how you can deliver these things. And having had the opportunity to speak with Dr. Norman and hear him speak and hear him have conversations about different things, it's helped me compare how I approach things to an expert, a long-term expert with lots of experience. Anecdotally, there was an artificial intelligence conference that I attended at McMaster. It was at the Grad Lounge. It's an old, nice building. It looks a lot like a small church. Dr. Norman was there, and I was seated at a table. There was a moderator at the table, so there was 3 talks. There were 3 individuals who were giving talks, and they gave discussion prompts. And during the discussion, something anecdotally that was positive for me is I was talking about some concepts that Dr. Norman hadn't necessarily heard before, and he basically said, well, sounds smart to me. So anecdotally, even though I'm presenting this in what some would consider a monotone way, it was like, man, I feel smart, and this guy's been doing this stuff for a long time. So I just happened to have a piece of information or pieces of information that gave me a different angle that he hadn't considered. Partially he hadn't considered it because he's had a long career, lots of expertise, also probably not looking the places that I'm looking because it's a non-standard angle that I took with respect to medical education. So, I've at least had the opportunity to sit beside the guy and have him say that he thinks I'm smart or that some of my ideas are good. Jokingly, one time he said there was some concept, and he's like, you definitely passed that course already, right? Something like that. I've quoted some of his research to him, which he appreciates because he put a lot of work into it. So if you can show somebody that your knowledge includes work that they've put forth, sometimes they can simply acknowledge it or actually help point you in the direction of something more that they've learned that would help modify your understanding better in the future. So I've had these opportunities to speak directly with people that were heavily involved in PBL. I'm just trying to tell you, don't leverage PBL. It's kind of a waste of your time unless your stated goal is for that to be the way that you're going to manage student satisfaction such that you'll maintain engagement. Other than that, regardless of who's doing it, whether it's the suggestion in that special education issue, the special education issue, or the education issues of the International Journal of Osteopathic Medicine, PBL is a nothing burger. It's kind of a waste of your time. So hopefully you've listened this far. Hopefully it comes across that my main aim is to be positive and supportive, to help people evolve their understanding of educational delivery, especially within a health profession. And hopefully you've learned something. Thank you for listening. We'll talk again soon.